It is well known that addiction is a challenge facing many families in the child welfare system. Many of these families face additional challenges related to poverty, such as a lack of affordable housing, stable employment, and access to treatment, and often need more time than other families to reach their goal of reunification.
I was 18 when I had my first child. I did have the help of my mom, and I did graduate with my diploma. And soon after graduation, starting in end of August, beginning of September, I was enrolled in college. I'm at an age where you're in college, you party and drink and hang out with your friends and have a good time, and that's how addiction all starts. Like, it starts on the weekends, and then sometimes you just lose control. It goes from the weekends to once like a Tuesday or Wednesday, then Tuesday, Wednesday, Thursday, and all day Tuesday. And my situation was more intense than that. Like, I'm a college student with a medically fragile child, and I can't go out and party when I'm trying to focus on getting my child back.
Most people, when they hear the word addiction, especially heroin addiction, but really all addictions, they view it to a large degree with a certain amount of judgment and a sense that there are moral issues involved. But people need to understand that there is substance abuse and then there's addiction. When a person becomes addicted to a substance, there's something that actually changes in the brain. Both structural and chemical changes happen in the brain to adapt to the substances of abuse. And in essence, then the word has been used, the brain has been hijacked. And despite negative consequences in their lives, they continue to use because of the brain changes.
It doesn't attach itself to any particular person. Race doesn't matter, ethnicity doesn't matter, socioeconomic status doesn't matter.
Intelligence isn't going to prevent you from getting addicted. Your family's income is not going to prevent you from getting addicted. It crosses all those barriers, and if all you needed to do is be rational and intelligent to recover, a lot more people would recover. But it really is a seductive, insidious type disease.
I think there are many misconceptions about families who enter the child welfare system because of a drug issue. For example, I think there's this general presumption that they're there because of some failure of will, some just not really wanting to stop, when in fact, I don't think any of our clients and the families that we work with, any of those parents woke up one day and said, I'm going to go out and get a really tough drug problem that's going to take up all of my energy and resources to keep.
When somebody is part of the child welfare system, and certainly if DCP&P is involved and their custody either has been taken away or is in jeopardy, and they have an addiction problem, that is going to make management of that addiction much more difficult. For example, I'm medical director of a methadone treatment program. My patients have to come to our clinic every day initially when they start treatment. Can you imagine trying to come to a treatment program every day when you don't have a means of transportation, when you have 3 young children, you're trying to get them to school or take care of them before you leave the house to get medication? I marvel that our patients do as well as they do in treatment when they are struggling with so many aspects of living in poverty.
Addiction doesn't come in isolation. There's some type of other factors that played a part into it. Sometimes it's domestic violence. It could be some type of physical health condition, maybe even mental health.
Many of our families are in unstable housing. They're living in shelters and waiting for housing to open up. Many of our clients are unable to find employment or stable work. So when you confound a substance use issue with all of those other issues that make your life feel unstable or your future insecure, I think it's especially difficult to start to address why you use, what started you to use, and start to empower you to make that sort of change in yourself to stop.
Sometimes I think the court system with their hours, so to speak, is really not always that conducive to somebody putting their life back together, particularly when somebody has a long history of addiction and never has maintained employment and is finally really trying to hold the job, and then you got to take off once or twice a month for court. That can be a huge thing.
I think another misconception is that recovery is a linear process, that we start recovering and at point A and we're supposed to travel along and get to point B. In fact, I think recovery can be a rather circular process. Parents can get stuck at certain stages of recovery, and sometimes we can see a relapse. That doesn't mean that the parent has gone all the way back to point A. It means that the parent is in their journey of recovery, has had a misstep, has had a relapse, and then must, move forward.
Addiction is a chronic disease, meaning that it doesn't go away when a person stops using. They still have to take steps to keep the illness in remission. If a person engages in recovery behavior for 6 months, not necessarily only treatment and counseling, but also, engagement in the 12-step community, basically, they have a higher chance of recovering, and studies have shown that. And a lot of that can be attributed to that their brains are kind of getting back to normal and the cravings are subsiding and stuff. Now, relapse is always part of the picture. So if somebody relapses, say, in month 11, they should be congratulated. That's a lot of time to put together. And if they relapse and get right back on the horse that threw them, so to speak, they should be really applauded for that.
So nationally, as we know, there's a very strict timeline for a parent to recover from drug dependence. And it's a timeline of 15 out of 22 months. And oftentimes, I think the way that's interpreted is that a court requires a parent to have been sober for 15 of 22 months. When you juxtapose that with recovery and the challenges of recovery, I think that timeline is really out of sync with the reality of recovery and the journey toward recovery.
If you have somebody who's truly motivated for treatment, has really shown that they're making an effort, their sobriety is extremely important to them, and they happen to relapse because multiple stressors in their life took place, and even just the stressor of knowing that your child is coming back after you haven't had your child for a year, you're very anxious. Am I going to be a good parent? Am I going to be able to handle this? Yes, it can be, self-sabotage in a way, but it's really that stress of, am I going to be successful?
Right now, addiction is treated almost synonymously with child neglect. So what you often see are the courts treating evidence of drug use as the same as evidence of child neglect. And I think what we're trying to move toward is an understanding that drug use is not synonymous with child neglect, that it actually a more case-specific, family-specific inquiry is necessary.
An addict who is working a program of recovery and is not using drugs, there's no reason why that person can't be a good parent.
I think one of the major changes that we could see is really to meet these families with compassion and not blame. There's growing recognition that the public health harm reduction approach versus a legal punitive approach is much more effective. So I think if we are really looking for a way to address the issue of drug use by parents or by pregnant women in particular, we need to have an approach that is compassionate, that offers the help that is needed, and doesn't drive them away from getting the support and strength that we can give them.
We need to understand as individuals, as professionals, what addiction really is. If there was a program or maybe a grant to be able to have that holistic approach, maybe being able to provide some type of job search, housing, and even job placement after someone has completed a program, it would be phenomenal.
Our patients all want their children back. It's the rare person who says, I can't do this, I don't want this child, let someone else take care of it. Now, in some cases, it may not be appropriate for that person because they really can't be a good parent. But that again is the rare case. As long as they make treatment a priority and have made a commitment to abstinence, even if there's stumbling blocks along the way, and there are always going to be, as long as that commitment is there, there's hope.
A complex challenge such as addiction in families requires holistic, community-based, non-threatening approaches. Services to support these families in their recovery should be offered early and well in advance of removal. With regard to the federal guideline that termination of parental rights proceedings must be initiated for children who have been in foster care for 15 of the most recent 22 months, we need to recognize that relapse, waiting lists for needed services, and the instability of housing and employment opportunities may render this timeline unrealistic. Exceptions to New Jersey's time limit should be applied whenever possible for those parents who have shown a commitment to recovery, but for whom 12 to 15 months is simply not enough time.